Welcome to the module on 7-point plan for comprehensive diarrhea control. We all know what needs to be done to address the problem of childhood diarrhea. A 7-point package of proven treatment and prevention strategies are now available, and if taken to a higher scale, would have a long-lasting impact on reducing child deaths and would lead to a significant reduction in the diarrhea burden in near future. 7-point plan has jointly been suggested by WHO and UNICEF for improving child survival in developing countries. By the end of this module, you will be able to describe 7-point plan for diarrhea control, list the treatment and prevention packages, promote the importance of early and exclusive breastfeeding, demonstrate the procedure for hand washing with soap, list the types of water treatment, explain methods for water treatment. Improved access to wash is critical to diarrhea reduction. However, it is not sufficient enough to effectively tackle diarrhea-related death and illness. Recognizing high scale of diarrhea incidents in India, Save the Children has adopted WHO UNICEF 7-point plan for prevention and control of diarrhea through Stop Diarrhea Initiative. Stop Diarrhea Initiative is a flagship program of the organization with a focus on 9 districts in 4 states: West Bengal, Uttar Pradesh, Uttarakhand and Delhi, that has started in April 2015. The 7-point plan includes 2 treatment and 5 prevention strategies. Treatment package includes fluid replacement to prevent dehydration and zinc supplementation. Prevention strategies are rotavirus and measles vaccinations, promotion of early and exclusive breastfeeding and vitamin A supplementation, promotion of hand washing with soap, improved water supply, including treatment and safe storage of water, and community-wide sanitation promotion. Oral rehydration therapy is the basis of fluid replacement. New elements of this approach include low osmolarity ORS, which are more effective at replacing fluids than the previous ORS formulation, and zinc treatment, which decreases diarrhea severity and duration. Rules for treating diarrhea at home. Educate the mothers of diarrheal child the method of making ORS and guide them to feed the same to the child. Educate the mothers to supplement the zinc tablets for 14 days along with ORS. If the condition of a child does not improve, immediately take the child to the nearest healthcare center. Comparison of standard and low osmolarity ORS solutions in terms of composition is given below. The original ORS was found to be hyperosmolar and may risk hypernatremia, high plasma sodium concentration, and increase in stool output, especially in infants and young children. The low osmolarity ORS reduces stool output by 25% and reduces vomiting by 30%. Zinc is a vital micronutrient essential for protein synthesis, cell growth and differentiation, immune function, and intestinal transport of water and electrolytes. Important additional components of the package are continued feeding, including breastfeeding, during the diarrhea episode, and use of appropriate fluids available in the home if ORS is not available. The prevention package emphasis on rotavirus and measles vaccinations, early breastfeeding, vitamin A supplementation, hand washing with soap, access to safe drinking water, and spreading community-wide sanitation promotion. Most of the children experience vomiting or diarrhea at some point of time, and parents deal with this routinely. Many of these illnesses may be caused by a virus called rotavirus. Most babies recover at home, but in small number of cases, rotavirus infection can become serious, with babies getting dehydrated, losing body fluids, and possibly needing hospital treatment. Prevention aspects also include vaccinations for rotavirus and measles, which is estimated to cause about 40% of hospital admissions due to diarrhea among children under 5 worldwide. Diarrhea caused by rotavirus cannot be prevented solely by improvements in water and sanitation. Rotavirus vaccine does not prevent other pathogens, such as E. coli and Shigella, from causing diarrhea. How is rotavirus spread? Rotavirus can spread very easily, and once infected, babies can pass it on to others. The virus can be spread through hand-to-mouth contact and be picked up from contaminated surfaces such as toys, hands, or dirty nappies. Washing hands and keeping surfaces clean can help reduce the spread of the virus, but can never completely stop it. Measles vaccination. Measles is a very contagious disease caused by a virus. It spreads through the air when an infected person coughs or sneezes. Measles starts with fever. Soon after, it causes a cough, running nose, and red eyes. Rash of tiny red spots breaks out. It may start with the head and spreads to the rest of the body. Promotion of early and exclusive breastfeeding and vitamin A supplementation. Early initiation of breastfeeding immediately after birth, preferably within 1 hour. Exclusive breastfeeding for the first 6 months of life, that is 180 days. No other foods or fluids, not even water, but allows infant to receive ORS, drops, syrups of vitamins, minerals, and medicines when required. Timely introduction of complementary feeding, solid, semi-solid, or soft foods after the age of 6 months, that is 180 days. Promotion of hand washing with soap. Do you know 80% of infections can be spread by hands and contaminated surfaces? Hand washing as practice needs to be taught from a very early age so that school children adopt the practice and continue to use it as they grow along with influencing others to do so. Every year, children do not live to celebrate their 5th birthday because of diarrhea and pneumonia. Hand washing with soap is among the most effective and inexpensive ways to prevent these diseases. Improved water supply, quantity and quality, including treatment and safe storage of household water. Improving access to safe and sustainable water supply by working with the local government to increase piped water supply in the target locations. Training for local mechanics to ensure effective functioning of the hand pumps in the communities. A large proportion of the water comes from the ground through hand pumps or bore wells. How contaminants get into a water supply? Water is contaminated because wastewater released from factories, pesticides used for agriculture, leakage of petroleum products, animal waste and dead animals, and sewage and household wastewater released into the lake, pond, or river. Contaminated water can be treated at the household and community level. Household water treatment. Household water treatment is the activity to improve water quality undertaken at the household level using a water filter, biosand filter, disinfection using solar energy, chlorination, and boiling. These are the water treatment options that are currently being promoted. Safe water storage is the use of clean containers with covers and good hygiene behaviors that prevent contamination during water collection, transport, and storage in the home. A household water treatment that happens at the point of water collection rather than at a large centralized location, which improves water quality and reduces diarrheal disease in developing countries. Water treatment devices can be installed in individual house or at the community level to support and maintain the hygienic standard. Safe storage of household water. Safe household water storage is a critical component of a household water treatment and safe storage system being promoted by the World Health Organization worldwide in areas that do not have piped drinking water. In some areas, drinking water will be stored in a pot, jar, crock, or other container in the home. Wrong handling and access to the water leads to contamination from dirty hands and utensils. Drinking water containers with narrow dispensers are the key to keeping water from being contaminated while being stored in the home. Community-wide sanitation promotion. Hand washing is considered as one of the most effective hygiene promotion activities for public health in developing countries. Gap between knowledge and practice still persists in hand washing practices. Long-term and extensive initiatives can alert people about the effectiveness of hand washing. Action plan to reduce the child deaths from diarrhea. Let us explore these action plans. Mobilize and allocate resources for diarrhea control, which includes new resources for child survival, must include funding for diarrhea prevention and treatment. Global initiatives must keep the management of diarrhea high on the list of priorities for public health resource allocation, including rotavirus vaccination. National and district health planners should include diarrhea control in program targeting childhood malaria, pneumonia, and HIV, and ensure support to accelerate coverage of proven interventions. Reinstate diarrhea prevention and treatment as a cornerstone of community-based primary healthcare. To control the diarrhea, effective treatment and prevention measures should be integrated into the training programs for health workers. Ensure that low osmolarity ORS and zinc are adopted as policy in all countries. Clear policy guidance is required to ensure the latest recommendations for treating childhood diarrhea are adopted. We should emphasize on including low osmolarity ORS and zinc supplement should be included in a single treatment kit. Reach every child with effective interventions. Community-based approaches are needed to ensure high coverage of health, nutrition and water, and sanitation interventions. Rather than relying solely on the public sector for these services. Accelerate the provision of basic water and sanitation services. This can be accomplished through partnerships between the health sector and other agencies responsible for water and sanitation, and the use of community-based approaches. Eliminating open defecation must be a priority, along with promoting the construction of basic sanitation facilities by households and providing safe water facilities close to people's homes that can be operated and maintained by the community. Use innovative strategies to increase the adoption of proven measures against diarrhea. We have to explore the available options to reach every household with a package of high-impact interventions against diarrhea. This can be achieved through the development of flavored ORS formulas, implementing systems for treating and safely storing household water. Also, by promoting exclusive usage of ORS, soap, and household water treatment. Change behaviors through community involvement, education, and health promotion activities. Clear and targeted health promotion and behavior change communication. Programs must accompany the delivery of interventions to ensure that caregivers understand the simple actions they can take at home to prevent and manage diarrhea. Make health systems work to control diarrhea. These include meeting the need for human resources, reducing staff turnover, improving training programs, and seeking creative ways to motivate community health workers. Monitor progress at all levels and make the results count. National level programs accelerate their diarrhea control activities. It will become increasingly important for countries to collect, analyze, and report quality data in a timely manner to monitor programs and increase accountability and performance.